Hello, I'm going to call doctor about the patient's dialysis disequilibrium syndrome. Hi, Dr. Lee, it's Katie, RN, calling from 3D hemodialysis unit. Patient room 3, Mr. Bill. During hemodialysis, his blood pressure is dropping to 90/60 and become confused, anxious, and complain headache, nausea, vomiting, muscle cramps, and tremors. Patient Mr. Bill, 50 years old, was admitted on May 20, diagnosed with ESRD, trouble breathing, edema on extremities because fluid overload. Before hemodialysis, he was oriented and vital signs were stable. Today is his very first time of hemodialysis. His coma scale, eyes open 4, verbal 4, motor 5. He cannot obey my command. Now baby blood pressure 90/60. His baseline was 120/80. Now his pulse 120. Respiratory rate 20. Temperature 36.7. Saturation, O2 saturation 95%. Patient has no bleeding tendency. His face has no pale. He has no pain. I think the problem is during hemodialysis, fluid rapidly removed from his body, causing his blood pressure drop. And I think might need to slow blood flow during hemodialysis. And do you have any hemodialysis order need to change? Any blood test need to check? Any medications need to add? How often do you want to check vital signs and contrast label? Are you able to come to check a patient and explain patient's condition to family? And now I'm going to call doctor about hypokalemia. Hi, Dr. Lee, it's RN Katie, calling from 3D hemodialysis unit. Patient room 2, during peritoneal dialysis, Mr. Joy has complained severe muscle weakness, muscle cramps on his legs, light headache, and dizziness. And patient Mr. Joy, 40 years old, was admitted on May 21st with renal failure. He has received the treatment of peritoneal dialysis 3 times a week for 1 year. He just finished peritoneal dialysis 3 hours ago. Patients are oriented. Vital signs are within normal. O2 saturation 96%, no respiratory distress. He lost his appetite since 3 days ago. He ate 30% of breakfast and 30% lunch yesterday too. He doesn't have a diarrhea. Intake output is negative 800 cc during 24 hours. Muscle power decreased, cannot against my hands resistant. He has a hypoactive bowel movement. I think it might be poor intake and peritoneal dialysis causing electrolyte imbalance. Any blood tests like chemistry, sodium, and potassium, calcium phosphate need to check. Any medication do you want to add? Do you want to consult dietitian for poor appetite? Do you want to monitor his ECG? Thank you.